Hello there, how are you doing? You're watching My Doctor Show and my name is Purity Museo. Now, oral health is an important aspect of our lives. The mouth is a gatekeeper to the outside world and the rest of the body. So this means that a healthy mouth will constitute to a healthy body. But how do we do, or how well are we doing to ensure that we keep our mouth healthy? Now, according to the World Health Organization, about 60 to 90% of children and almost 100% of adults have dental cavities. Now, let me bring you back home, whereby in Kenya, according to the latest report by the Kenya National Oral Health Survey, about 23% of children have dental caries, and this means the gum disease, and also means pain and discomfort. 3 to 5 children as well have experienced some bleeding of the gums. And so our topic of discussion today is children and oral health. And to help us with that discussion in studio, we will be having a very important guest. His name is Alan Ochanji. He is a dentist, and at the same time, he is the vice chairperson for the Kenya Medical Practitioners, Dentist and Pharmacist Union. That is who we'll be talking with today on this particular show. But before we have a look at what some of the Kenyans had to say about oral health, or how often do we even brush a child's teeth, we want to welcome all our viewers, wherever it is that you're watching us from. Your questions are welcome to this particular show. Remember, you can talk to us. The SMS line is 20268. The number to call in will be displayed on your screen. My name is Purity Museo, so just sit back, relax, and learn from this exciting show ahead. First, your views.
Yeah, I feel it's very important to take care of kids' teeth. Yes, at an early age, preferably when they start teething immediately. Yes, we ought to take care of their teeth. Yes, for them to have strong and healthy teeth and gums too. Yes, in the future.
Niko na mtoto lakini ako na miaka kama 2 na sijui kama huwa anabrashiwa meno.
Okay, niko na wawili, but mmoja ako 1 year and a half. Huyo sijaanza kumbrush because hata hajamea meno zote, lakini huyo mwingine ako 9 years na yeye nimeanza kumbrush.
Even if you don't use a brush, there are ways of cleaning the teeth. You can use a clean piece of cloth. Take a little, maybe Colgate, and brush, so that unajua milk pia inakuanga na effect kwa meno. So that hizo remains do not decay on the teeth. At the age of 1 to 2, then from there they started learning on their own. Yeah.
Watoto watatu, wawili tayari wametoka college. The youngest is 10 years old. Wameanza kuwa na dentist wakiwa watoto.
Ana brushing, lakini meno yake ilianza kumekiwa brown. So anaenda kwa daktari kwa sikujua ilianza kumekiwa brown kwa nini. Anaenda kuona daktari ndio watoe hiyo brownness.
So today our topic of discussion is children and oral health, and remember we are talking about all aspects there is about oral health for children. We'll be looking at what oral health is and what can go wrong on the mouth of a child, and most importantly what we need to do to ensure that a mouth of a child is healthy. And to help us with that discussion in studio we have Alan Ochanji. Thank you so much for coming.
Thank you.
And welcome to My Doctor Show.
Thank you.
All right, so today we're talking about something very important. We're talking about oral health, especially for children. Sure. Maybe we could start by talking about what are we talking about, or what is the composition of a mouth for a child? We understand that for an adult we're talking about that 2 teeth, but for a child, what are we talking about exactly?
Okay, thank you, Purity. It's great to be in your studio. Let's talk about children oral health. Investing in your child's oral health is the greatest investment you can ever do in terms of future health and bringing the confidence of that person and having good general health. Teeth are in 2 sets. The milk teeth, called the pediatric teeth, and then there's the permanent dentition. The milk teeth, as we commonly know it, are 20 in number. They start developing at the age of about 6 months, and then they go up to 2.5 years. Then after that, at the age of 6, the first permanent tooth, which is usually the first molar, comes into the mouth. Now, the mouth has other things apart from the tooth. We have the tongue there, we have soft tissue, we have the gum. Generally what we call the support structures. We also have the salivary glands that bring saliva into the mouth. So all this, they work in unity to bring a common function. So taking care of your teeth and the general mouth is very, very important.
And now we're talking about children. When it's all about children, because most people, as we've seen on that particular clip, they don't take care of their children's health because they do not understand first how to go about it. Sure. So let's distinguish between the two. How you're taking care of an adult teeth, is it a similar way with the children?
It's not similar, it's different, because most people, as we've watched from the clip, they come in at a very late stage. By the time they come in, usually damage has occurred. And you know, in children, the immune system has not fully developed. So any slight challenge brings with it worse consequences. People tend to take care of the teeth when the child is very advanced in age. But taking care of your teeth, and more so for your child, starts way early, even before those teeth actually come into the mouth. Because what you do when you are expecting contributes to what happens to those teeth when they finally come into your mouth.
Really?
For example, there's a viewer who said when the kid was born, he or she was born with the brown teeth.
Yeah.
What affects the color of the teeth mostly is what is called fluoride, that's in water. And part of it is contributed by the kind of water the mother is using when she's pregnant. Now, when the baby finally comes, again, don't wait for the tooth to come into mouth. Start cleaning that oral cavity as if there was tooth in it. Get something like a cotton gauze, and then clean that surface. Usually what happens is the mother's milk has a lot of sugar in it. So left untreated, it will go into the areas that will finally affect the teeth that are coming into place. Then when the first tooth comes into place at about 6 months, also do the same. Just take a clean cotton gauze, then clean the surface of the tooth. You can put a small toothpaste, just like a pellet, on that goes, and then you clean. And then as they advance in age, by the age of 2 or 3 years old, they should be able to use the pediatric toothbrushes. We have toothbrushes for adults, and then you also have toothbrushes for children.
Right.
So by the time they're advancing in age, 2 to 3, they should be able to handle a toothbrush, but still up to the age of 6, it should be your duty as a parent, your duty as a guardian to monitor them so that they get the good habit. The other thing you can do is to make sure that they feel it's fun.
Right.
So when you're brushing, you can tag them along, you brush together. Probably when you're going to do shopping for brushes, you allow them also to choose the kind of colors they want. In that way, they feel the part of it, and they inculcate that good behavior the rest of their life.
Right, and for a set of teeth, when you're talking about children, how many should a normal kid, how many teeth should a normal kid have?
A normal kid who has developed all the milk teeth should have 20 in number. Now, because of sometimes they're not taken good care of, you find that when one is coming, one has come out, one has cavity, one has discolored. So, and then sometimes because of lack of information, people tend to go for removal. So at some point, in one point to the other, you find that they don't have the full set of dentition. But a normal child with the full milk teeth should have 20 number.
20?
Then after that, the mixed dentition comes in, where now the permanent ones start coming in. And then when in adult full dentition, one is supposed to have 32. So the transition between the 20 number and the full 32 goes all the way up to somewhere like 12 years old. And then the wisdom teeth comes much, much later when they're into their teens and in adulthood. Yes.
And what sorts of infections that come with unhealthy oral hygiene?
In children, the most common dental infection is called dental abscess.
Right.
It presents as a swelling, but the origin is a tooth that has cavity. And what it causes cavity is you have a challenge. You have food staying in the mouth,
Right.
and then the bacteria that occur in the mouth act into them, then they produce an acid. Then that erodes the tooth surface, you form a cavity. Then with that pathway, it goes all the way into the underlying structures. So it will present as a swelling, but the origin is a tooth with a cavity. It can also come from the surrounding soft tissue called the gum, because there's usually a pocket between the tooth and the gum, over which there are food particles that could trickle into.
Right.
So the idea here is to keep food as much as possible away from the mouth. The other problem that causes abscesses, and it's possible to see it in children where they present with almost all the teeth black in color, is what we call bottle feeding. Sometimes we find it so easy to take the kids to sleep by just giving them a bottle to feed on and then they sleep. What we don't know is that it contains a lot of sugar that is harmful to the health of the teeth. So you could do it in a programmed way,
Right.
that you don't overdo it, you don't overdo snacking, so that they have ample time to clean up, and then you also avoid snacking towards bedtime. The other thing you could do is to make sure you have a balanced diet, because again it contributes to having enough calcium, enough phosphorus, and just adequate fluoride that you need for the health of your gum.
All right. Okay, talk to us. The hashtag is MyDoctor. We are at Ebru TV on Twitter. You can simply talk to us through our Facebook page, Ebru TV Kenya, or simply send us an SMS. The SMS line is 20268, and the number to call us is displayed right on your screen. We are talking about children and oral health, and we are looking at how do we keep the mouth or the teeth of our children healthy. And in studio we have Dr. Alan Ochanji. He is the Vice Chair for KMPDU, or Kenya Medical Practitioners, Dentist and Pharmacist Union. He's a dentist. And Doc, you're talking about some of the infections that come with, or complications that children may face. Let's talk about is it bad breath?
Bad breath,
You know,
yes.
bad breath. There is lots of bad breath among, especially for children, and most of us ignore it. We maybe assume it's normal, but what contributes to that?
Okay, bad breath, I would say 3/4 of it comes from the mouth itself.
Right.
Okay. There could be other cases where you have bad breath coming from the rest of the digestive system, but the bulk of it comes from the mouth. And it still boils down to how you're brushing, because the back of the tongue, if not cleaned very well, would contribute to bad breath. If you have your teeth not cleaned, and then the food particles that are accumulating between your gum and the tooth,
Right.
they will contribute to bad health, bad breath. If you have a cavity, it also harbors food particles when you're eating, and then maybe there's no effective way of cleaning up. All those contribute to bad health. So bad health is just a way of showing that there's a defective system in how you clean your mouth and how you take good care of your oral hygiene. So 3/4 in the mouth. There could be other factors, systemic for that matter, that contributes to bad health, maybe medication, how you are rehydrated, but the bulk of it, it's how you keep your teeth clean.
And Doc, because we are talking about keeping the teeth of our children healthy, maybe we could now talk about how do we ensure that the teeth or the mouth of our children is healthy.
First is the technique of how you're brushing. I've said children have 20 teeth in number. They're divided into portions. The most important thing is to get access to each and every tooth surface. With me is a model here.
Right.
This is for adults, but I could use it to explain as well what will happen in children. The most effective way is to maybe put them into groups.
Right.
And this, as a guardian, you have to supervise. So you could choose and maybe put them in a set of 3 or 4. Then you just use a gentle toothbrush. There's no need of getting a hard one or a harsh one.
Right.
There's so many in the supermarket. Get one with soft bristles, and then you put the teeth into groups
Right.
for effectivity. So once you do that, you just have a gentle stroke back and forth. The tooth has 3 surfaces
Right.
for the behind teeth. So there's the surface, the outside surface, which we call the labial surface. Then there's the top,
Yes.
and then there's the inside. Most of the time, people do a
The
cleaning on the
outside.
outside,
Yeah.
but they forget that you have a surface on top and a surface inside. So you could do that, and then an effective way of doing that is you can assign a number of strokes, maybe so that you remember very well. You can say, I'll do 10 or 20 here, on top and on top, just to inculcate a habit. Once you're done with that set, you move to front ones,
Right.
do outside and inside.
Maybe you can lift it up a little bit for
You
viewers.
also do the outside. For the front one, you do outside
Right.
and inside. You can put your brush at an angle to make sure it. Again, it's very important to clean the front and the inside, because this is where we have salivary glands. On the back side, you do the same. Outside, top, and inside.
Right.
The same number of strokes. When you're done with that one on the lower side, you go to the upper side. When that is done, it gives you an opportunity to monitor the outcome. Now, the other thing is the type of the toothbrush.
Right.
Children, they have the specific type. that
How
needs
do
to
you
use.
know?
They're in the supermarkets. Definitely in terms of size, you will see them. But
Yes.
even in terms of the head size and everything, you'll get a small size that can adapt into the children's mouth.
And Doc, just on the type of the kinds of toothbrush to
Yes.
be used, some people, or majority of people, go just buy them to the from the shops around or next to them. Is it still are they still recommended, or how are you able to know that this is a kind of brush that is recommended by a dentist?
We know particularly in a kind of a brush, in terms of a brand.
Right.
There are several in the market. What is most important is the kind of bristle and the angulation of the edge. So long as it can reach the most posterior part, that's the behindmost part of your mouth. There are in the supermarket a number of them. It's important to get one that will reach every corner of your mouth. And getting more than one set is not bad in a way, that you can use them. And then you make sure that you change them every so often, because once you've used it after a given period, it starts wearing off.
Right.
So how effective it becomes, again, becomes eroded. So you can change it, we say about 4 months, but up to 6 months could still do. Again, it comes to your duty as a parent,
Right.
to make sure that this is supervised. Up to 6 years, you have to take good care of it and supervise them to do it. The other time when you are using the toothpaste, you have also to monitor to make sure that they don't swallow it, because it's possible when they're doing it,
Yeah.
in the process they can swallow it. So put a small portion and then just monitor how they're doing it. By the time they're 6, 7, they're already able to know how to spit, how to eliminate
Right.
toothpaste from the mouth, and they can't choke, they can't swallow or do anything. The idea is to just get involved in their life and be part of the solution.
And what age are we talking about?
The age at which you're supposed to start cleaning, as I had mentioned, starts way early, even before the teeth come into the mouth. The teeth will come into the mouth of a child at the age of like 6 months. Before then, you are supposed to clean that arch without teeth to remove the remains of milk and everything. When the first tooth comes into the mouth, and they're usually the first lower front teeth, you take a small gauze, clean, and just clean it with water. Then as that advances, you introduce toothpaste. At the age of 2 to 3, they should be able to hold the normal toothbrush for kids.
Right.
And then you put just a small portion of toothpaste to make sure they don't swallow or choke or anything.
Right.
As this advances, by the time they're 6, you can introduce dental floss. They can brush on their own, but still you monitor. Then I also told you like some tricks to make sure they are involved. You can let them choose the kind of colors they want in terms of toothbrush. You can tag them along. Again, be a good example. When
Right.
they see you brushing every time, twice in a day before you go to bed, they pick that as a bit that they should grow with.
And someone may be asking, what is fluoride and how do I know that my baby is getting the right amount?
Fluoride is an element that it's a very important component as a mineral of the tooth. Most of the toothbrushes that are sold, toothpaste, sorry, that are sold in the markets, they contain fluoride. Fluoride is meant for the integrity and the strength of your teeth,
Right.
together with calcium and phosphorus. Most of them are obtained in the food supplement that we take. But for fluoride, sometimes it's found in water.
Right.
Now, if it's excess, it also comes with problems. That's when you get browning of teeth.
Right.
If it's deficient, the teeth also become weak. So there must be a balance in between. We
Right.
need them, but not in excess and not in deficient amounts.
And someone is asking, hi, I hear of plastic teeth in newborn babies, and I hear that they may cause death. Please, could you educate us on that?
There's a name for them, not plastic. Probably sometimes they're called neonatal teeth.
Yeah.
Those that the children are born with. It just means that the development process occurred earlier than expected. So mostly we assess, and then sometimes we just remove, because one, there'll be maybe one, and then the rest haven't come out. So they'll cause trauma to the mother. When they're suckling, they'll be biting and all that. So sometimes we just assess and remove.
Right.
Because it usually happens when there's an extra set that has not yet come out. So the one that came prematurely, prenatally, we just remove it.
Right.
And it's a myth that they cause death or not, neither here nor there. We remove it purely on the kind of damage it will cause to the mother.
Right.
And even the child, when they become loose, they might swallow it and suffocate. So we just remove it for precaution.
Right.
measure.
And Doc, when you're talking about children, what age group are we talking about here?
Children is it's a range. But the point at which you're supposed to supervise vary. Where you're supposed to directly clean for them is up to maybe 2.5 years. After 3 years to 6 years, they're supposed to clean themselves, but you monitor. Then beyond that, you leave them with the good habit that you've done, but once in a while you check how they're doing it. Even beyond 12 years old, they're still children.
Right.
That's the age that now they present with malalignment, what sometimes people call crooked teeth.
Right.
Sometimes they use some scary words. But it's just that the child is developing, the arch size is smaller, so the number of teeth may not be accommodated, so some erupt in the wrong position. So even then, you still need to come in as a guardian to make sure that they get what we call orthodontic treatment,
Right.
which is mostly to do with the alignment and putting braces. That in a way brings functionality, and also it brings with it the confidence and self-esteem
Right.
that the child will need. Because there's a lot of intimidation when they go to school and the peers look at them and they have malalignment. Then it comes and bites them in terms of self-esteem. So you need to bring up a person who is self-confident and have the self-esteem it needs.
And remember, today it's children and oral health, and to help us discuss that, we have Dr. Alan Ochanji in studio. Keep talking to us. The SMS line is 20268, and the number that you could use to call us in or to reach us on is displayed on your screen. On Twitter, we are at Ebru TV Kenya, and the hashtag will always be my doctor. I can still see some of your questions, but remember, we'll be looking at them in a short while. It still matters, children and oral health. And Doc, you've mentioned age bracket when you're talking about children, but someone may be asking, how do I take care of a child or the mouth? It's a mouth because this is a child that has not started teething yet. How do you go about that?
One, I said it starts before birth occurs, because the kind of diet is very important. I've mentioned the kind of water you're using. If it's one that has too much fluoride, then when the child is born, please ensure balanced diet, because in that way you'll ensure there's enough calcium, enough phosphate, enough fluorides, plus other important elements that you need for the teeth to be strong.
Right.
Also, the other thing you have to limit, as I had mentioned, is the kind of how you feed the kid. The use of bottle is very common, but when overdone, it comes with consequences, because it contains a lot of sugar, and it's very normal to take a child to sleep with the bottle in the mouth.
Yes.
But when they're going to sleep, the saliva rate reduces, and then the sugar is all in the mouth. That contributes to decay.
Right.
When the kid does not have teeth, probably the question will be, why are we cleaning the mouth? You'll get that there are sockets over which the tooth will come out. When tooth accumulate there, they'll get focal abscesses, that is infection, which is contributed by the food and the bacteria in the mouth. So still you need to clean so that even the crypts of the forming teeth do not form abscess that will affect the teeth that is coming into the mouth. Then more importantly, you need to inculcate the good habit of just going to see a dentist for a checkup. Mostly when kids are taken to the dentist, they go when there's already a problem. So in a way, they develop a phobia because they were taken when there's a problem. And you see, if this happened way earlier where they're just taken like, you're going to visit a dentist, I'm going, me, I'm the father, but I bring you along just to see how the environment is, becomes friends with the dentist and all that.
All right.
It brings some sense of getting used to that so that if there's a problem, it's identified way earlier.
And now that you're talking about, for a child who's not started teething yet, there is still some good diet that that person or that children should be taking so that you ensure that the mouth is not infected, as you say, right? All right, so let's have a look at some video with or keeping your mouth healthy, or how to eat some diet that will ensure that the mouth of your child does not develop complications, maybe now or in the future. Take a look. And of course, your comments are always welcome. The number, you can call us live on 0791 478 990. I want to repeat that number. It's 0791 478 990, or simply send us an SMS via 20268. We are talking about children and oral health, and to help us discuss that in studio, we have Dr. Alan Ochanji, and he is a dentist, and at the same time, he is the vice chairperson for the Doctors Union here in the country. Welcome back, Doc.
Thank you.
And we've seen some of the kind of diets that we should be giving to our children, but just before we get that, maybe we could quickly talk about flossing.
Yes.
What is flossing?
Flossing is a form of interdental cleaning. Cleaning that is aimed at in between the teeth. Earlier I described how you're supposed to brush, but you realize even with that and the conventional toothbrush, you may not go in between the teeth. So flossing is a way of, it's like a string enriched sometimes with fluoride to go in between the teeth. Where the toothbrush cannot reach, you go in with a toothbrush. Apart from flossing, there are also other ways of interdental cleaning, and they're called interdental toothbrushes. They're also small. They go in between the teeth. So the two are just ways of making sure that when you're cleaning, over and above cleaning the outside, the top, and even the inside, you also go in between the teeth.
And is it recommended?
It is recommended. For children, you'll have to wait until the teeth get into contact, because as they grow, there are spaces in between, so you may not need to do flossing. But as they advance in age, the teeth get close together and there's compact in between, so where food can go. So that's where you do flossing.
Right. And maybe at home, because most parents do flossing. Yes. How many times should we do it, maybe in a day or in a week?
Well, we would advise that every time you're brushing, you also floss, but maybe it might not be practical. So the best time to do it when you have adequate time is just before you go to bed.
Every day?
Okay, every day. Make sure and you do it on every tooth contact surface. It's not just on the front teeth, all the teeth. So it's some good amount of work that you have to do.
We're talking about children here. You floss our children's teeth?
Yes, from the age of up to, I think by 4, the teeth are already into contact where they can hold food in between. That's when now you start cleaning in between. Because if you don't clean, that's where you'll get what you call proximal cavities in between the teeth. So that's where you come in. And it's usually way cheaper preventing than waiting for cavities to form and starting the treatment.
Right. All right, and when we come back, we want to look at now the wisdom teeth and a child, because there is a notion of so much complications that come with wisdom teeth. Yes. All right, it's now time for us to take a very quick breather here on My Doctor Show, and when we come back, of course, we'll also be looking at your comments and your questions. Keep texting. The SMS line is 20268, and the call line is 0791 478 990. 0791 478 990. We are going to take a very quick break. We are back shortly. Don't go too far. Welcome back to this very last part of my doctor show. You're watching my doctor show, and today we are talking about children and oral health. My name is Purity Museo, and in studio we have Alan Ochanji. He is a dentist and the vice chairperson for the KMPD, or the Doctors Union. Remember, it's time now to have a look at some of your questions and comments. The number to call us or to reach us on will always be 0791 478 990, or you can send us an SMS via 20268. Welcome back, Doc. Welcome back to this second part of my doctor show. And earlier on we were talking about so many infections for children that come with maybe unhygiene when it comes to oral care. So what triggers these infections and how can they be avoided in the future?
I could put it into two main triggers. One is just neglect. Neglect will be because of lack of information, or it will be contributed to some extent by poverty, where probably they're not able to access.
And maybe, would you allow me to cut you short to receive a call? All right, let's hear from Mercy from Thika. Hi, Mercy.
Hi.
Hi, please talk to us.
Okay, I was asking a question for my kid.
Right.
Hi.
Hello, I can hear you, Mercy. Just reduce the volume of your TV.
Okay. Yeah, I wanted to know about my kid who is 2.5 years.
Right.
Yeah, and his tooth have a decay from the gum. He has a decay. And
go ahead, Mercy.
okay, so it is like the teeth is like it's cutting off. He doesn't have the strong teeth.
Yes.
So I wanted to know what might be the problem, because it's not about I used to brush my son, and I can't see any change. I went to the doctor and he just told me this is just the end. Yani itatoka. Daktari aliniambia hiyo meno itatoka, so it's not a big deal. So I'm worried if the tooth is cuts off, even before it starts shedding off, what will happen?
Okay, Mercy. We've heard you. Doc, you've heard Mercy?
Yes, I've heard Mercy. Mercy, I sympathize with you. But then it comes back to what I was saying, that for you to get symptoms the way Mercy is experiencing, the events that might have occurred, that probably as a dentist I would be interested to know.
Right.
That
it's the child.
Yes, the child. So during the pregnancy, what kind of the environment was the mother in? Or there's some level of fluorides that were more than usual in the waters? Because when they're not controlled, they contribute to molting and cavities on the tooth surface. Again, I would be interested to know how Mercy took care of the teeth for the son in this case, between the time he was born and the time she started noticing the symptoms. Again, sometimes because of the damage, we may not do anything.
Right.
So we may eventually lose the tooth. It's not good to lose a milk tooth. Well, people think losing the milk tooth is, after all, we'll get a permanent one. But the greatest role the milk tooth is playing is what we call space maintenance. It preserves that space until the permanent one comes into place. So should we unfortunately lose that tooth, then we'll find ways of doing space maintenance in that tooth. But before we go to that extent, still it's possible to do something subject to examination. I would strongly advise that she seeks a second opinion from a qualified colleague who would advise and give all these options. Because even a case where you've lost a tooth, you still need to protect that space for the permanent tooth to come in. And we have ways of doing space maintenance.
Right, and just before we get to what will happen, because you said it's not really advisable or it's not good to lose the milk teeth.
Sure.
Then before we get to what will happen, my director tells me there's another caller. Hello?
Hello.
Yes, hello, you Moses?
Yes.
Yes, go ahead, please.
Now, the question is, I'm having an issue with my baby. She just turned 3 and she has cerebral palsy,
Right.
and she's taking meds. And these meds are taking, what do you call it? The meds she's taking are giving her some sort of toothache.
Right.
So right now we cannot go ahead and brush our teeth easily because having cerebral palsy kind of makes her not being a normal kid just makes it difficult for the brushing and all. So I wanted to know how to go about it, whether or what gel we can use or whatever we can use for the baby and all.
Okay. Thank you, Moses. He's talking about the baby taking drugs for a different condition, but it's affecting the mouth. The teeth are so painful.
True.
So he's saying that they can't go ahead and brush the teeth for that particular kid.
Yes.
Is it advisable not to go ahead, or should they continue, and what's the way forward for that family?
At any point, everyone with the tooth in the mouth, they should be able to brush. But in this case, is a baby who is challenged because he's having a systemic condition.
Right.
So in this case, he will need to have more attention from a caregiver
Right.
in terms of a dentist or a professional.
Mhm.
Because over and above the fact that he's a kid, he's also having a systemic challenge.
Right.
So we'll need to put him or her at a place where the cavities are taken care of,
Right.
all of them are filled. And then from there henceforth, the caregiver will have to go out of his or her way to specifically brush for them until they're at a level where they're able to take care of that condition. But before then, we may need to also take care of the medical condition and make sure it's stable. Also take care of the dental infection, because the reason as to why they're not brushing is because they're having cavities. So with cavities, there's sensitivity, and so you fear brushing. Now, when that is happening, it's like a loop, a positive feedback, where you're not brushing, it's getting more and more, and then you're thinking by avoiding, you're helping, yet it's getting worse. So we need to come at a point where we fill all the cavities, remove all the risk factors, and then now manage the kid both medically because of the condition, and then on a follow-up for dental treatment.
And there's a question of teething. There's someone who's called asking, the baby is over 1 year now, but he or she is not teething yet.
Okay.
Should she begin getting worried? And someone else is asking about now the permanent teeth. This is not the milk teeth.
Yes.
When should the permanent teeth begin now coming out?
Okay. Now, there are timelines for teeth to come into the mouth. If it overstays, then we get worried, because there's the way the nature is planned, so that when ones get out, we give space for another one.
Right.
Okay. So chances are that if you have milk tooth that overstays, it will prevent the permanent one from coming in. So the permanent one may not come into place, or when it eventually comes into place, it will come in the wrong position.
Okay.
So the teeth that overstays, mostly we remove them to give way for the permanent one, but you have to do assessment, and there are timelines. I said the first milk tooth to appear in the mouth at 6 months. The first permanent tooth to appear in the mouth is at 6 years.
And because, Doc, we just want you to take us through, when should we expect our children to be teething, and as well, when do we expect the permanent teeth to be coming out? Just hold on that. There's someone who's calling us from Thika. Hello.
Hello, how are you?
Hi, I'm good. And you?
I'm well. Now, I wanted to ask the doc, when the kids are really young and they can't know how to spit once you brush.
Right.
So how do you train them how to spit?
You heard?
Yes.
Okay, thank you so much. We are going to respond to you. I don't know which one should we begin with now.
We can begin with that. Spitting, it's a habit that you have to train. It's not something, the child is growing. You're coming from a point where she's just born, or he or she is born, and you don't know anything. So all these things, you train them as they continue. And that's why I said the first amount of toothpaste that you put, it's very minimal, just like a piece drop onto the surface. With that, you train them slowly by slowly to get the habit. You can start with water without toothpaste, because with water, even if they swallow, there's no problem.
Right.
Then as they get that habit, you also introduce toothpaste along, so that it's something that they get used to. Again, it's a habit. They are not born knowing that, so you'll have to take your time as a parent and train them. The way
Right.
you'll train them to eat in a plate, the
Right.
same way you'll train them to brush.
Before we forget, our previous caller was asking about when my child is about 1 year and he or she is not teething yet, should I get worried or what should I do?
So the timelines I was talking about is between 6 months and probably 2.5 years, all the full set of milk teeth are in the mouth. Then there's a quiet period until after about 5.5 for those early, then about 6 and even 6.5 for those who are late. At 6 and 6.5, which is supposed to be having the first permanent teeth in the mouth, the first molars, and with that also follows the central.
So
that's
many
the upper.
people, making me to just tell you to hold on kidogo. Okay, let's hear from Catherine. But we're coming back to
No,
you,
it's okay,
who was asking about my child is 1 year old and he is not teething yet. Should I get worried? But first, let's have a look at what Catherine is saying. Hello, Catherine.
Hello?
Yes, Kate?
Yeah, my son is 2.5 years. And his two front upper teeth, they are brownish. I don't know what causes that. We keep brushing, but they are just brownish. What causes that?
Okay. Thank you, Kate. You've heard about brown teeth.
Yeah,
There's also someone else who was asking about my children, all of them, their teeth are brown. What is the problem and what should I do to avoid that?
The browning teeth is a common problem. Sometimes it's beyond us because we live in an area where sometimes, depending on where you are raised up, there's a lot of fluoride in water, especially on the floor of the Rift Valley and even some other parts of Kenya. The amount of fluoride in water, more so the borehole water, it's a lot. It's sometimes advisable that during pregnancy you control the kind of drinking water, especially, and then you also monitor the kind of water the child is going to use on the first few years of life. Because presenting with brown teeth at 2.5 years, the most common cause is what you were using, the kind of water you were using as a mother during the pregnancy, and the kind of water the baby has been using the first maybe 2.5 years of life. Now, when it finally presents, the only thing that we can do is one, to come to us to assess the damage. If the damage is a lot, which usually presents with molded surfaces and cavities, we just fill. And then also we cover the defect so that it doesn't spread. But most importantly is the information that when you're pregnant, control the kind of water you're drinking. And even when the baby is born, be wary of borehole water because they contain a lot of fluoride.
And now for these particular children who already have brown teeth, is there a way out of this or that's how it's going to be?
So once they are having a case, now it's a curative case. So they have to come to a dentist and there are several things that can be done. At this part, preventive will be most important, but should it occur, is not an end in itself. There's so much that you can do to bring functionality, to bring confidence, and to restore form. Yes.
Let's get back to our previous
The
caller.
timeline.
The timelines.
The timeline at 6.5 years at least, going to 7, you should be having at least the first molars and the front teeth. So if they extend beyond 8 years, 7, 9, it's a worry because at that particular time, the other set of teeth are supposed to be coming. So normally, if you notice that around that age bracket, it's going beyond, then you can just come to us, we remove and then assess how far the permanent one is supposed to come into place.
Right. Okay, thank you so much for that. And there's someone else, maybe we can read one message. Hi, my name is Phoebe, and my baby is 10 months old, and the 2 upper teeth zimeanza kung'oka, anahara pia. So my question is this normal?
Okay, I'm a bit lost. 10 months?
10 months, the 2 upper,
Yeah.
the upper 2 teeth, as in they're like chucking, zimeanza kung'oka, and at the same time, this particular child is experiencing some diarrhea. So she's asking, is this normal?
There are 2 questions there. One is the diarrhea that people relate to when teeth are forming, and I think it's sort of a myth. It's not founded, but probably because of the oral hygiene surrounding that time of teeth erupting into the mouth, they could also get other sort of infection that affect the entire digestive system, in this case diarrhea. But more importantly, it's not normal to lose tooth at 10 months.
Right.
So I would be interested to know why they're losing that tooth. Is it that the tooth is coming out completely, or is it that they're cut into half, so there's a portion that is remaining? And the most common in this case is what I was talking about, the bottle syndrome, where you give the baby the bottle and then they sleep, or actually breastfeeding, they go to bed with milk in their mouth. They usually tend to destroy the teeth completely to an extent that they're cut into half.
Right.
Because of the milk and the acid that is produced, it really destroys the tooth. And you know, at that age, it's not enough in terms of minerals to withstand that environment.
All right, and we have Joyce from Eldoret calling. Hello, Joyce.
Hi.
Hi.
So I have my son is 6 years old.
Okay.
And there are major problems with his dental. First of all, the bite is reversed.
Right.
The first, it's supposed to, okay, the front part.
Go
the
ahead.
First part, okay, the front part is behind and the lower part, so the bite is reversible. And then he has a decay.
Right.
On the molars, and then apparently one molar came out, the other one didn't come out. I took him to the hospital, and he had a filling on one of the tooth. So what do you do? So another problem is that the upper part, the two milk teeth are chipped, and there's an infection on it, and he has a problem eating hard food. Could that be the problem of the teeth or the bite?
Okay.
Yeah.
Thank you, Joyce.
Okay.
I think she has raised 3 issues.
Yes, Joyce from Eldoret.